Hi, I'm Rob MacIsaac.
And I'm Stephanie. I'm a registered nurse working in the operating room with the General.
We're here today to talk about 3 things you should know about being an OR nurse.
So the first thing you need to know, Rob, is that an OR nurse has a skill set that can be applied to any surgery within the operating room. So we can transition from the general service to the plastic service to all of the other services, and our skill set can be utilized in each different department.
That must make for a very interesting work life.
It makes for a very interesting work life. There's no monotony in OR nursing. So the next thing you need to know, Rob, is that an OR nurse manages all of the activities within the operating room. So we can have a couple of different roles. We can either be the circulating nurse or we can be the scrub nurse, depending on what your assignment for that day has been.
Can you talk about, I'm interested in the different roles between a scrub nurse versus a circulating nurse.
Sure. The scrub nurse role is what most people would typically associate with what they think an OR nurse does. So you're scrubbed, you're gowned, you're directly in the surgical field, you're handing up surgical instruments. When you're the circulating nurse, you manage everything beyond the surgical field. So in that capacity, you're doing things like providing equipment up to the sterile field that needs to be opened, assisting anesthesia, managing the counts, managing the chart, but you're also doing other things. You're maintaining the flow of the operating room. So there's a lot of different balls in the air at the same time. It's the ultimate exercise in multitasking.
So maybe tell us about, given the nature of the job, what kind of person really thrives as an OR nurse?
An OR nurse has to be somebody who does well under pressure, who is adaptable and thrives on constant change.
So what is it about the OR that calls all that into play?
I can safely say that the operating room is the safest place to be in the hospital. There's always multiple highly trained, skilled individuals in play. That being said, so many things can happen. You can be doing what anyone would consider to be just a basic, generic case, and that can change at the drop of a hat, where all of a sudden things have gotten to be a lot more critical and require more serious intervention. In those situations, you need to be prepared to act, prepared to intervene, and be okay functioning in those circumstances.
I get it. So I really enjoyed meeting Stephanie today and getting shown through the OR and having a conversation with her about the role of the OR nurse. I think the 3 things you should know about OR nurses is, first of all, they start off as nurses and then train up to be OR nurses, so it's a kind of specialization within the nursing field. But for every OR nurse, they can end up doing so many different things, so they don't specialize by procedure, but they specialize by the fact that they're an OR nurse. So the second thing you should know about OR nurses is the fact that they really facilitate the operation of a smooth operating room. They're the ones that really facilitate everything going well, making sure that the surgeons and everybody else in the room has everything that they need. So it's a really critical role. The last thing is, I think, they need to expect the unexpected. There's so many different things that can happen in an OR, and it really goes to the role and the nature of the role of an OR nurse that they need to be prepared to deal with urgent things as they occur. So there's a lot of flexibility, a lot of different parts to the job. I think it's a very rewarding job, exciting, fast-paced, and I admired the role that Stephanie is working on. It's amazing to me that we have a shortage of OR nurses, because I do think it's a role that is super valuable within the hospital, and so if you're thinking about becoming an OR nurse, please let us know, because we'd like to help you along that journey. Anyway, that's it for today, and I'll see you next time.